Is my doctor wrong about not wearing a headband after ear pinning? I've read everywhere that you're supposed to wear a headband or compression band at some point after having your ears pinned back. My doctor says, no, don't worry about it. You don't need it, it's fine. I'm very concerned, and my ears are very swollen.
Thank you for your question. You're asking if your doctor is wrong for not recommending that you wear a headband after having otoplasty surgery, and that in your research you've learned that other doctors do recommend wearing a headband, and that you're also concerned about the swelling of your ear. Well, certainly I can assist you in guiding you about what's going on. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon, practicing in Manhattan and Long Island for over 20 years. And otoplasty is a part of my practice, and I do have some opinions on how I approach prominent ears. But certainly I can give you a perspective from what I'm seeing with the photos you've submitted. So my first observation is, of course, that you also have stitches where there would be for a facelift. So it appears to me that you had both a facelift and an otoplasty done at the same time, and that your concern is in less than a week's time, since your stitches are still present, at least from what I see on your photo. So with that being said, your doctor performed this otoplasty, and if you trusted your doctor to do your facelift and your otoplasty, I can't see why there would be that much of a doubt that your doctor is somehow not guiding you appropriately on the aftercare. You know, with the facelift, most likely you already had a kind of a bandage, which to some degree could have helped support the splinting that is often of benefit after otoplasty. Just to kind of give you an understanding of what otoplasty means from a surgeon's perspective, is basically when you're dealing with prominent ears, you're dealing with two types of issues. One is called a hypertrophic or enlarged conchal bowl, which is the central part of the ear, and then there is the absence of a defined antihelical fold, which is the upper part of the ear. So when there is a hypertrophic or thickened conchal bowl or middle third of the ear, the options are to either do something called a setback, where sutures are just used to pull the ear inward, or to actually do resection of cartilage and suture the cartilage to the fascia or the mastoid fascia against towards the skull. And then with the antihelical fold, there's basically what most doctors do is some variation of something called a Mustardi procedure, which is weakening the cartilage and using some type of horizontal mattress sutures, which is a technical term, but basically folding from the inside the ear so it's closer to the head and creates that fold. Now, it's not surprising that you do have a fair amount of swelling, considering you had both the facelifting surgery and the otoplasty at the same time. The important thing here is that your doctor's judgment on how much support and splinting is necessary. It is routine in my practice to use headbands, but it is not routine for me to do otoplasty at the same time as a facelift. It just doesn't seem to be something that people want when they have facelifting. A lot of our patients who have facelifts are women, and which is reflective of the norm. And a lot of times they wear their hair long, so they're not that concerned about prominent ears. But as far as the reason for not wearing the headband, I would suspect your doctor may be concerned that the headband may be putting too much pressure and could potentially cause a fracturing of the cartilage in a way that would be undesirable. So it appears that at least the ears are in good position relative to the head, so that chances are your doctor probably feels comfortable with the way it looks without adding more pressure. It might also be related to the facelift and other concurrent procedures. So I think it's unfortunate for you that you feel like that you want to question that your doctor is right or wrong, because in medicine it's always about judgment. There rarely is any situation very black and white. There's a lot of gray, and a lot of that gray comes from the experience and clinical practice of medicine. Your doctor may feel that after your sutures are removed and observing how the ear looks, they may want to recommend that you wear a headband or some variation to try to put some protection and to put some pressure on that area to maintain its appearance. But I certainly wouldn't abandon faith and just question the doctor as to not being competent or not doing the right thing for you by not having you wear a headband. Ask your doctor why, and if once you hear an explanation, you might feel more satisfied or comfortable with why the choice was made. A lot of times once a person understands, that's why we spend so much time with our patients, and we spend a lot of time discussing, explaining, and teaching. I feel that adult education is basically spaced repetition, and you can't say things often enough, but you have to space them apart for it to kind of take hold, for the information to take hold. So we always welcome our patients to ask as often as they need to and to call as often as they need to, even no matter how many times we tell them anything, because this is very important to educate and reinforce education. So with that being said, speak to your doctor and find out the reasoning, and I'm sure that as time goes on you'll get an understanding, and hopefully things will work out in the way you hoped. So I hope that was helpful. I wish you the best of luck, and thank you for your question.